and thanks for tuning in to our Blueprint video. My name is Alicia Watley, and I'm with Kentucky Youth Advocates, and I'm here today with my colleague, Shannon Moody. We've been receiving questions over the last couple of months from advocates all over the state about what's going on with the child policy landscape in Kentucky. So today we're going to dive into those, answer some questions, and also talk a little bit about the 2026 Blueprint for Kentucky's Children Policy Agenda and what we're working on for kids across the state. So as we prepare for 2026, Kentucky Youth Advocates is really excited to be putting out an agenda that is focused on child health and well-being and safety, and finding ways that we can prioritize everything that kids need to thrive across the state. So we know that Kentucky legislators have been working really hard over the last several months. In Frankfort, they've been meeting in committees and task forces and learning about the issues that matter to Kentucky kids and families. So we're going to be talking a little bit more about what KYA's team has been seeing, what are some of the themes that have been coming up, and what we're going to be working on in response to that. So I think to get us started, we will talk a little bit about what's happening in the child welfare sector. So Shannon, do you want to talk a little bit about what we're seeing in Frankfort?
Yeah, definitely. So Alicia, we had a couple of questions submitted related to both DCBS workforce and kinship care. So I know if you're following the news at all, you've seen a couple of articles lately around kinship care and what's going on with benefits in that space. But let's start with the DCBS workforce. And what we do know is that over the last couple of biennial budgets, we have seen an investment in DCBS workforce and just workforce issues to address workforce issues within the Child Protective Services sector. And what we are seeing is a stabilization of the workforce. We certainly have, continue to have issues within caseloads, and in Jefferson County are continuing to see some much needed improvements there. It's still not quite where it needs to be, but overall, by and large, we are seeing an improvement, and our workforce is really starting to stabilize across the state when it comes to Child Protective Service workers. Now, what we also know is that in the kinship care space, we have actually added helpers, kinship navigators within the Department for Community-Based Services who are helping kinship caregivers navigate the child welfare system, make decisions about when their children come into their home and what to do and how to make the decisions around needed supports. And that's a really important function of the kinship navigator, and also really important for our relative caregivers who have tough decisions to make and not a lot of time to make those decisions. So we know that there are supports, really more supports than we've ever seen for kinship caregivers across the Commonwealth of Kentucky, but we also know that there's still a lot of work to do in making sure that our caregivers are supported. And we unfortunately also did see a decrease in the Kentucky Transitional Assistance Program subsidy. We don't know for how long that's going to last, but that does impact our kinship caregivers significantly.
So can you tell us a little bit about what Kentucky Youth Advocates is looking at for the Blueprint agenda for 2026 in this sector?
Yeah, definitely. So we obviously work with partners across the state of Kentucky to help identify what goes on the agenda for the Blueprint for Kentucky's children, and especially in the space of child abuse and neglect, we heavily rely on our partners within the Co-Safer Kids Face It movement. And they have continued to identify some opportunities around keeping kids safe in schools, whether it's around educator sexual misconduct or ensuring that there are practices that prohibit grooming of students. So we know that we'll likely see that on the agenda again this year, and hope to see some movement in that space. Mm-hmm. We also know that another way to make sure that our families are safe and taken care of, and we're really following best practices when it comes to kids when they are in the child welfare system, is ensuring for parenting time visitation. We don't support that right now financially to ensure that parents can access those, but it's really important to create some opportunities to at least subsidize those visitations so that not only children can visit their parents and start to work towards the case plan, whether it's reunification or another permanency opportunity, and making sure that our kids can visit their siblings and connect and spend time with their siblings. In that similar vein, we're also looking at some improvements to the guardian ad litem and court-appointed counsel legal representation. There is a huge need for improving the overall legal representation of both kids and their parents in the child welfare system, and we know that reduces time in foster care, increases time to permanency, and overall can really support the outcomes of the child welfare system. And then finally, we anticipate seeing a bill related to ensuring that youth who are in the foster care system, especially our older youth who are looking to transition to adulthood, have access to IDs, and state IDs in particular, and have the opportunity to get those at no cost or very low cost, and streamlining the process in order to get access to those IDs. So we've got a robust agenda within the child welfare space, and we always do every year because we have a lot of people who are engaged in this space, and it's a big system, just similar to health, right? We see that in the health space. What do you anticipate happening in the health space in 2026, Alicia?
Yeah, absolutely. So we know that in the health space right now, we're seeing something that's kind of new to Kentucky, coming out of the actually from the national scene. The Make America Healthy Again movement is here in Kentucky. There's actually a new task force that's meeting throughout the summer, and they will continue to meet for the rest of the year. And so that is something that has grabbed a lot of attention. A lot of our legislators are interested, and that task force is bipartisan, and it has Kentucky Senate and House members that are meeting and just kind of learning about health topics and what's impacting kids' health across the state right now. So we're interested to see what else they cover. They've talked a lot about nutrition, but they're also interested in looking at things like youth mental health and environmental factors that might be influencing health overall for our kids. And so as we think about what that means for the Blueprint agenda and kind of what we want to prioritize, there's a couple of things that kind of rise to the top for us, I think. And one of those is looking ahead. This has not come to fruition just yet, but we are anticipating, because Kentucky is one of many states that has filed a lawsuit against social media companies, kind of around their role in the impact on youth mental health over the last several years. What has that looked like, and how can we address some of the challenges that youth are facing with mental health? And so what we're anticipating is that in the next couple of years, Kentucky will start to receive some settlement dollars from that lawsuit from social media companies and their role in that. And so we would really like to see some focus in 2026 from our legislature on what are we going to do when that money starts flowing into the state. We know that from some past settlements that we've had in the state, such as the opioid abatement settlement and others, it's really helpful to have sort of a structure in place before those dollars start coming in. So what we're going to be looking for is how can we prioritize things like positive childhood experiences. How can that money be invested into after school time activities that are healthy and safe for kids? To just provide environments that are contributing to positive youth mental health and not continuing to put them into any sort of danger. So we're hoping to see, like I said, just some structure put around that for what that will look like. And then also on settlement dollars, this is something that we've worked on for a couple of years, but we are already receiving some settlement dollars from another lawsuit against Juul, which is one of the makers of e-cigarettes. And we know that that is one of those environmental toxins, nicotine products that are really impacting youth across the state and across the country as well. And so we're looking for, again, those dollars to be put back into youth in a positive way. And so in this case, we want those Juul settlement dollars going towards youth prevention and cessation of those nicotine products so that they're not continuing to be exposed to those products and can get help to quit if they're already using them. And then the other thing that I think is going to continue to come up in the health space is just looking at things like Medicaid coverage and making sure that our kids have the access to health care that they need, protecting the investments that we already have in the Medicaid system, and making sure that we are not seeing any negative impacts from some of sort of the national changes that are coming down space. We know there's a lot of changes happening, but I think that there's good opportunities to continue to protect kids' access here in the state. So we're going to be keeping a close eye on that as well. And the other thing, as we're talking about behavioral health and youth mental health, that is often connected is what's happening in our juvenile justice system in Kentucky, another big focus. So I'll let Shannon, do you want to talk a little bit about what we're seeing in Frankfort, what the interests are, and what that means for policy agenda?
Yeah, definitely. So we know that there's a lot of conversations happening around juvenile justice and accountability when it comes to especially youth committing violent crimes or crimes that are on a felony level. There's a lot of interest in making sure that there's accountability, but there's also a balance with ensuring we're meeting youth where they are developmentally. So I think we anticipate seeing some bills filed this upcoming legislative session. What we hope to see is an option to ensure accountability while also ensuring that our young people have what they need both when they are being processed through the system, if they have to be processed through the juvenile justice system, and then when they leave detention that they're connected to the appropriate opportunities after, so that they can reintegrate back into the community safely and in a long-term way. So I know that we will likely see some priorities around Miranda rights and making sure that youth are, if they are waiving their Miranda rights, they have an opportunity first to speak to an attorney. Mm-hmm. That is something we're unfortunately seeing is happening as youth come in, they'll waive the Miranda rights, and then down the road they realize that maybe they shouldn't have done that as they go throughout the process. So having just that quick pause to make sure that they talk to an attorney before saying yes or no, they're going to waive the rights or they're going to ensure that the rights are maintained. We'll likely see that come about. And then also, again, some opportunities when it comes to addressing youth in a meaningful way and potentially engaging their parents in that process as well. We've had some conversations with legislators around what does it look like to hold parents accountable in that on that side of things. And we really need to take a look at what best practices say and what the research says about how we move youth through a system to ensure for safety, accountability, and then also good practices that don't result in youth recidivating or coming into detention and then it being kind of a revolving door. And then one more really proactive side of things is we're seeing, unfortunately, youth who are truant or where we're seeing issues of chronic absenteeism. There are programs across the state of Kentucky, but they're not necessarily situated across every community, are parent engagement meetings. And these are held typically within the community mental health centers or the community collaboratives for children. And they create an opportunity for children in elementary school to connect with the schools and their parents to ensure that kids are coming to school, they're addressing barriers that are keeping them from coming to school, and have an opportunity to really set the stage for regular participation in school from elementary school and well beyond. Because we know that education plays a really big role in our future success, right? And if we are helping youth become tax-paying citizens, we have an opportunity to do that while they're young and in school. And I think that's connected to what we'll hopefully be seeing in the economic security space as well.
Yeah, absolutely. So I know that in the economic security space, we're seeing some continued focus from previous years from our lawmakers. For instance, we are seeing a second year of a housing task force here in Kentucky. We know that's a continued focus. A big issue still is the availability, the affordability, the safe conditions of housing across the state. So we know that task force is, again, meeting the second year in a row, trying to figure out kind of how we can make housing affordable for everyone and accessible. And so on our side here at KYA, we're going to be continuing to look at how can we make sure that housing is safe and stable for our kids across the state. And so that includes things like common sense changes to the eviction process and utility disconnections so that kids are not being harmed or impacted in a way they don't need to be. So really just minimizing what that looks like on kids. On the Blueprint Agenda in 26. And then the other thing that we're seeing is, you mentioned this a little bit earlier in the child welfare section, but in Frankfort, there's kind of some attention being drawn to those basic needs support programs. So things like KTEP it has just been cut recently, and then also SNAP. We know at the federal level there's a lot happening there, and so we know that the state's going to have to take a look at that program and really figure out what it's going to look like going forward here in the state for our kids and families. So we're going to be here at KYA focused on how do we protect access to those critical programs that we know families are relying on, while also making sure that the eligibility makes sense and that it is providing what it needs to the people who need it most. Yeah. And then we're also looking at some new initiatives that we think could really help with basic needs for our families. So one is many states across the country have done this, and Kentucky is looking at exempting diapers from the state sales tax to reduce that financial burden on families with young kids. So we're really interested in seeing what that could do for families. The other thing that is, it was filed last year, but kind of new focus for KYA this year, is sort of taking a broader look at what our Kentucky policy landscape does for families and kids. And that's going to be during the legislative process. So we're going to be looking for a bill filed to establish a child and family impact statement. And what this means is that anytime legislation is proposed, our legislators are looking at making a change to the state budget or to our laws here in the state, that they take a minute and really look at how that will impact kids and families across the state. And so a lot of these factors are going to be things in this economic security sector. So it's going to be things like, how will this increase or decrease accessibility of housing or affordability of those things? How is it going to impact those public benefit programs or health care? So all of those things we will hope will be considered in those impact statements to really make sure that our legislators are taking the time to think about what that will look like for kids and families. And another piece that we hope will be included in those statements and that consideration is really education. What does it look like to educate kids in Kentucky? And so that could be things like early childhood education, but it could also be the K-12 education system. And we hope that the impact statements would also include a look at that as well. And so that kind of leads us into our next sector here, which is a focus on education, starting from the very beginning, from birth. So do you want to talk a little bit about what that looks like? And I think we received a question about this as well.
We did, yeah. And we received a question about implementation of the possibility of universal preschool. And one of the things that Kentucky Youth Advocates and a lot of our partners in this childcare space within Convergence and the work that's being led by the Kentucky Chamber is that we need to ensure that both things can happen, right? We need to ensure that the childcare sector and that availability does not change if we implement pre-K for all kids. And I think there's a lot of discussion around what needs to happen in order for those two things to exist at the same time. And what we also know is that it's a big investment, and we are likely to be seeing some potential cuts because of what money isn't coming in to the state and the decisions that our legislature will have to make around our next biennial budget. So the question around pre-K for all or universal pre-K, I think we will have to wait and see. But what I do know is that we want to see a really strong childcare sector so that our families have access to quality, affordable childcare. And another way that we can ensure quality within childcare is by placing an emphasis on our kids with special needs. We see kids unfortunately being expelled from childcare centers because of behavioral issues or because within our childcare centers we just don't have enough workers who are capable of maintaining the milieu of a group in order to ensure that all kids are safe if they have a child who is having issues, especially children with autism or other developmental intellectual disabilities. So what we're hoping to see is within the 15 hours that our child care providers are required training, just generally for their certification, that they have 3 of those hours be dedicated to children with special needs, behaviors, neurodiversity, somewhere in the space of ensuring that our child care providers have what they need in order to adequately serve our kids who have behavioral issues or special needs. Another area that we're focused to with our families with young children is the paid family medical leave. So the state implemented paid leave for our state workers, which is a really exciting step. We definitely know that our families need to be able to access leave if they are having a child or adding to their family. And right now the current structure is that they are allowed leave every 10 years. We think that that gap needs to be closed and reduced to at least 3 years in order to really address what is actually happening within our families across the Commonwealth and make that paid family medical leave opportunity even stronger for our state employees. So I think that's what we're seeing overall on the 2026 agenda. I know as we get closer to Frankfort and the legislative session starting, things may change. But what would you recommend, Alicia, for folks who are getting involved and want to take charge in making some things happen over the next couple of months?
Yeah, thanks, Shannon. I think that there are so many opportunities right now. It's a great time for advocates to really be getting prepared for the 2026 session and taking some action to get things moving for that time. And so the first thing that we would recommend is reach out to us for an Advocacy 101 training for your organization or a group that you work with. We are always happy to provide that training, some help on how you can get involved in advocacy. The second thing that we would talk about right now is attending the Blueprint Summit, which is coming up on December 4th in Shelbyville, Kentucky. We're so excited to once again be bringing together advocates from all across the state for that event. And then the third thing is to reach out to your legislators now. This is a really good time to connect with your senator and your representative. They might be home a lot more during this time period, so you might be able to visit with them or talk to them in your home district near where you live. And you can always go to the, request to go to their Frankfort office as well if that's of interest to you. And so if you need help with that, you can always reach out to somebody on KYA's team and we can give you some tips on how to do that. But all of this can be found if you go to blueprintky.org to learn more about the Blueprint for Kentucky's Children. We're going to be releasing the full blueprint there for you to view, and you'll be able to see all of the items that we talked about today, as well as all of the resources on how to do the action steps that I just outlined. So thanks, Shannon, for joining me this morning.
Thanks, Alicia.